The other low-cost models, some are day centers, and we know about telemedicine, specialty care clinics, satellite clinics. And the other one, use of drones. As of now, we have not used drones in India because the government doesn't allow. But we've been talking to somebody, and they are perfecting a drone. And the model is like this. Telemedicine. So one of the consultants gives a diagnosis, and so there is obviously a lot of regulatory hassles in it, but assuming that it is legal to do it, and they say you do this is a medicine, how will this medicine reach you? So I have seen the live example of the drone, picks up the medicine, pre-program it, flies at least 40, 50 kilometers, delivers, comes back. It is a company called Vayu. So they are really, really experimenting on that. So if you do that, then the problem of physical access to a hospital or a consultant will really get shortened. So that is also happening in the country. Diagnosis. The big problem of diagnostics is that every second guy in the small towns or even big towns thinks that he can open a diagnostic center and provide that best diagnostics. I think that's not a model which will work. I think what will work is that they will have to be congregated to a few large players, and they should do the basic stuff. Let the bigger tests and the more complicated tests be done by bigger players. That's, of course, using high efficiency processes and protocols, and I think using IT in all the places. And the last thing is on focus on prevention. I think Dr. Joshi really talked about it, but I am going to give a practical solution here. Many of the pharma companies who are here, and I have been speaking to them, I'm going to speak again and again till they start doing it, is that every year when the salary increment is given, I am suggesting that 5,000 rupees increase from that goes into your mandatory health check. If you don't do the health check, you don't get paid for it. If you do it, you just get reimbursement. The moment you do that, what happens is, when you do the mandatory health check, all those things start becoming. You suddenly start becoming aware of the health prevention and things like that, about your sedentary lifestyle and food and so on and on. And it is a question of time that things will get fixed, because our system is so overburdened that we need more and more prevention today. Building capacity. So we talked about it, and now we are talking about some examples of using Moodle for education and telemedicine, simulation-based training we do. And the third thing, which I've been trying, but it's not working, but I'm hoping that someday it will work, that we will get an Uber for hospitals. And my concern with this, and the reason why I mention this, is that some hospitals like ours, very difficult to get beds. There are some hospitals within the city which have beds, but no patients. And we keep saying that our infrastructure is short. We don't have enough beds. You compare Central and South Bombay, we have more beds than what rest of the India needs, right? So we are like developed country. So why is it that those inefficiency in those hospitals cannot be fixed by a Uber-like phenomena? We've not been able to figure it out, so I'm hoping one of those startups will be able to help us with that. And of course, a lot of support from government required about the PPP and putting it in the top priority of what their policy should be. And I've already talked about many of these initiatives. So, I think the other thing we need is this, that if there is an innovation, we need to really let people try it. It's not saying that just because we have not done it. And to be very honest, it's a disclaimer that I've been on the provider side only for the last 2 years. And I think it is very rampant in the provider side, that we want to try, but we are very scared to try. So I think we will need to do a little bit of walking on the edge to see if we can try and get some innovation to provide, good solutions to everybody. So thank you, and all the best to everybody.
Thank you, Gautam. Thank you very much for that. Now, you, in this very, very thought-provoking talk of yours, you mentioned a couple of interesting things. You mentioned about using mobile to reach rural India. In other words, using digital media like maybe a cell phone and to reach patients and patrons in rural India. Now, some service providers, the better-known service providers I know, have already started doing this with a couple of big institutions, and they're trying to link up the opinion makers, the key opinion leader doctors from the big institutions to rural India and stuff like that. Are you also doing something like that in your institution? That's the first part of the question. The second, more important part of the question is, do you see this as the future? Do you see this galloping across in the next few years?
The answer to first question is, I cannot disclose.
Okay. Fair enough. The second part.
Okay. And the second part is, I think it's absolutely going to happen in the future. There's no doubt about it. And it is just a question of perfecting the model, because we need to bring the consultants and the patients together. And obviously, many things you cannot do on the mobile, but many of those things. I'm going to share an example. You know, for children, most pediatricians, and all of us know this, first thing, the child has a problem, has a fever, these guys check for ear infection. So for that, they have to go to the pediatrician and they check for ear infection. So I have seen an application where you put a otoscope kind of thing in a mobile, take a picture, send it through WhatsApp to the pediatrician. It's a very, very clear picture. They look at it and give the opinion back. Only problem in all these models today is that it is a wonderful model, but nobody knows how to monetize it. So the pediatrician doesn't want to do it because they don't know how to make money out of this. And so there is a little bit of a problem. But I think solutions like this will emerge very, very soon.
Yeah, I also know of a couple of, to use your language, large size hubs which have been created, or at least fairly large size hubs that have been created for different lifestyle conditions, wherein the patient, after visiting the doctor, then for the next month or two, a few weeks, is being monitored by the hub, and the feedback is being given to the doctor, and based on the feedback, the doctor alters the dosage and stuff like that, or calls the patient again. That's one step further.
Yes.
How far do you see this also galloping across, and more such hubs coming across in this country?
I think my view in this is that today we are, now I'm giving the hospital perspective. Today we are in the treatment of patient business, right? We treat the patients. But I think eventually what will happen is that we may have to take care of the community health. So for example, if I'm based in one area, I need to be responsible for the health of the community, which includes prevention, it includes monitoring, it includes treatment. So I think it'll all be encompassed there.
And finally, at least I personally liked your idea of mandatory health checkup. I mean, whatever may be the amount that's specified, that's separate. But yes, because I do know a lot of people, even in the elite part of society, who want to go but keep putting it off, saying that I've got something more important. It gets procrastinated, and that's never good. So that idea of having a mandatory checkup, I think is a very good idea.
And I have a suggestion for you and for all the people here, that everyone has a birthday. Most people have a birthday. So people give you gifts. I think it is time for all of us to give a gift to ourselves. So on our birthday, on that day or in that month, we should make it a point of giving ourselves a gift of a health checkup, which is good for us. And if it's mandatory, why don't do it in that month? So that's something which you can think about.
Good idea. Good idea. Yeah, the birthday month, maybe people will pick up, but ask people to go to a hospital on a birthday, they'll say, I better come to a Hilton rather than a hospital. So
let's do birthday month.
Enough. All right, but the idea is good. Basically, I think it's a very good idea. If somebody can do that on a mandatory basis, I think we'll have more and more people who are more conscious and keep a track of what's happening to themselves, and that's the biggest investment you can make. So, any further questions for Gautam? Thank you very much, and may we request the organizers to hand over. So you have a question? I'm so sorry, I didn't see you. Please go ahead. Yes. Yeah, do we have a floating microphone, please?
Hi Gautam, this is Kiran Srivastav from Molecule. Really liked whatever you spoke, the business model, the rural areas, and it's great. But don't you think that if the hospitals like Hinduja and other big hospitals take up certain causes under the CSR and create awareness, a simple thing like you just said, health checkup, why can't the hospitals or the companies take it up as a campaign to spread awareness, and maybe that could help? Has the hospitals ever thought something like this, to at least start off some kind of campaign to for public awareness things and things like that?
Uh, you can see in the country, many hospitals are doing some awareness campaigns. They are doing. But on specifically on this prevention thing, some are doing, some are not doing. What happens is in a hospital, everybody is so busy treating the ill people on a day-to-day basis that it's difficult to sit back and think. So, but now I think this has started, and in my small way, I am the vice president of the Association of Hospitals. So through that forum and through my earlier avatar, so I've been pushing this. Wherever I get a chance to talk to the government people, I'm asking them to include it in the budget. There was some conference of the OPPI, talked about it. So, these things happen, journey starts with a small step. So one person talks, then, it just spirals it.
Great, thank you. That's what I was saying. Prevention, if we could spread awareness, it will really help. Thank you.
Thanks.
Thank you. Thank you very much. There's one more question there, please. The microphone to him, please.
Can you hear me now? Yeah.
Absolutely.
I'm involved with more than one hospital, as you know. But I've been in Mumbai for the last 24 years. Brand Hinduja definitely stands out. So if somebody were to ask me that in last 25 years of my existence in Mumbai, is there one hospital which outshines all the rest? And I'm sure 99 out of 100 doctors in Mumbai, whether associated with Hinduja or not, are likely to give the same answer. So I just wanted to ask you what it takes to be brand Hinduja. Why is this particular hospital standing so tall compared to so many others who were taller in their heydays, but somehow just haven't stayed at the top, whereas Hinduja seems to be going strength to strength year after year?
Let me give you a perspective. When I was being interviewed by Mr. SP Hinduja, the final interview, so he told me one thing. He said, the most important thing for you, the most important thing is the clinical outcomes and the ethics and the reputation of the hospital. You do that, rest of the things will fall in place. Don't worry about the money generation. Don't worry about anything else. So I think that philosophy of the founder members and of the family and people like you who are committed to the cause and who are focused on the ethical delivery of patients. That, for example, that many of you may not know that we do at least 20% charity, free beds we have. And if somebody comes to Dr. Kaushal Pandey, he will not know whether he is paying patient or not paying patient. So the quality of care which is given to the patient is the same. And this enhances the ethical delivery values, and people really know that the patient care is supreme. So I think all these values just add up. So thank you.
That's lovely too. Thank you very much, and may I now request Satya Brahma to hand over a memento to Gautam.
But you have to speak your mind out, and Hinduja will grow to leaps and bounds, and I'm sure about it. This is thank you very much. A privilege to have you.
Thank you again. Our next speaker for the evening is Dr. Viral Desai, plastic and cosmetic surgeon. Dr. Viral Desai is aesthetic and cosmetic plastic laser reconstructive surgeon, medical director, DHI India, medical director, CPLSS. Dr. Desai always saw himself becoming